The truth is painful, but silence is deadlier. Every week, I see older men suffer not because of disease, but because of habits they thought were harmless, even healthy. What if I told you that the way you've been masturbating after 60 could be quietly wrecking your hormones, damaging your prostate, and even shortening your lifespan? My name is Dr. James Ellison. I'm a board-certified urologist and men's health specialist with over 30 years of experience, helping thousands of men live longer, stronger, and more confident lives. I'm not here to judge you. I'm here to protect you. Because when no one else is talking about this, I believe most men believe that masturbation is a safe and private act, something you don't outgrow and frankly shouldn't have to explain. But here's the paradox: after the age of 60, what once supported your vitality may actually be draining it. The very act that used to bring relief could now be causing fatigue, erectile issues, hormonal imbalances, even prostate complications. And you wouldn't know it until it's too late. In this guide, I'm going to reveal. The 5 most dangerous masturbation mistakes older men are making today. These aren't just minor slip-ups. These are medically documented age-specific risks that can undermine your testosterone damage, your pelvic floor, increase inflammation, and quietly disrupt your health from the inside out. And the best part: these mistakes are completely avoidable if you know what to change. So whether you're 60, 70, or even 85, this isn't about shame, it's about clarity. Stay with me, because mistake number 1 is something I guarantee 9 out of 10 men over 60 are doing, and it could be slowly shutting down your prostate function without you even realizing it. Before we go any deeper, if you're serious about protecting your health as you age, make sure to hit that subscribe button and turn on the bell so you never miss another important tip made just for men over 60. And if this video speaks to you, type 1 in the comments if you think I can do better. Type 0, your feedback helps me help you. Let's start with the first and perhaps most overlooked mistake. It's something many men do in private, thinking it's harmless, but it's silently rewiring your brain and, draining your desire. I'm talking about the way pornography affects your mind after 60. Mistake 1, using porn that overstimulates your brain and numbs your body. I've sat across from hundreds of men in their 60s, 70s, and even 80s, strong men. Honest men, men who've built businesses, raised families, fought through illness, and stood tall through life's storms. And yet when we talk about this topic, they suddenly look downshift in their chair and say something like, "Doc, I know it's weird to ask at my age, but is watching porn still okay?" It's not a strange question at all. In fact, it's one of the most important ones a man can ask after 60, because what you see on the screen and how often you see it doesn't just affect your mind, it affects your hormones, your erections, your confidence, your ability to feel connected, and even your long-term brain health. The problem isn't porn in itself. It's the way modern porn is designed: fast, aggressive, constantly switching angles, scenes, and stimulation. It overwhelms your brain's natural dopamine system. Especially as you age at 25, your brain can bounce back from that stimulation, but at 65 the chemistry changes, and what once gave you pleasure now leaves you numb, frustrated, or dependent. I've had patients tell me, "I can't get aroused without it anymore," or "I feel anxious and low after I finish." That's not a lack of manhood. That's biology reacting to overexposure. Your brain becomes less responsive to real, gentle arousal. You may find it harder to become erect without the visual overload. Worse, your body may start to dissociate from the act entirely. It's like your
mind is excited, but your body doesn't get the message anymore. This isn't just about sexual function either. It's about dignity. It's about control. When you rely on something external to feel pleasure, you hand over a piece of your autonomy, and after 60, when hormones are more fragile and energy takes longer to recover, that cost becomes much higher. Porn also alters how you perceive intimacy for men who've lost their partners or no longer have an active sex life. It can become a substitute for human connection, but no screen can offer the emotional safety and warmth of real
Touch over time. Some men find themselves using porn not for desire, but for distraction from loneliness, grief, or boredom. Now, don't get me wrong, I'm not here to shame you. I've counseled generals, farmers, professors, even priests. Good men who were never taught how the male brain changes with age. They didn't know that what felt harmless at 40 could become harmful at 70. What I always say is this: if it's leaving you feeling empty, tired, disconnected, or unsatisfied, it's time to rethink it. You deserve more than 5.
Cindy, minutes of escape followed by hours of fatigue or guilt. You deserve satisfaction that nourishes you, not drains you. So what can you do? Start by noticing how you feel after not during. That's always going to feel like relief. But what about 30 minutes later? 2 hours, do you feel grounded and calm or dull and restless? Your body tells the truth. If you listen, try taking a break for a week instead of screens. Explore touch with awareness. No goal, no rush, just sensation. It might feel unfamiliar at first, but most men report greater sensitivity, better erections, and even stronger emotional stability after just a short time away from visual stimuli. If going completely porn-free feels too big, reduce the intensity, choose slower content, avoid switching videos rapidly, and never masturbate when you're not actually aroused. That's when the body starts to treat it like a habit instead of a response. You can also try meditative or breathing techniques during self-pleasure. These help reconnect the mind and body, which often get separated after years of overstimulation. Remember what's good for high. Your brain is almost always good for your libido. Let me leave you with a story. One of my patients, Paul, was 68 when he came to see me. He'd been using porn almost daily, and he thought it was keeping him in shape, but he was exhausted, had trouble sleeping, and started experiencing erectile issues. After just 2 weeks of cutting back and focusing on slow, mindful touch, everything began to change. He told me, "I feel like my body is actually alive again, Doc." That's not a miracle. That's what happens when you stop numbing yourself and start tuning in. And if that resonated with you, if you're starting to wonder how many other invisible habits could be quietly harming your vitality, then you'll want to pay very close attention to the next mistake, because this one is even more common, and it's draining your energy in ways you've probably blamed on age. But it's not age, it's habit. Let's talk about it. If you're still here, and this message is striking a chord with you, drop a number 1 in the comments to let me know you're with me now. Let's keep going and dive into the second mistake you need to know about. Mistake 2, masturbating too frequently without recovery time. One of the most misunderstood truths about male health after 60 is how much more rest and recovery your body needs, not just from exercise or stress, but from arousal itself. I've seen it countless times in my office. A man will come in, often looking a little embarrassed, and say something like, "Doc, I feel tired all the time. I'm not sleeping well. My energy's dropping and my mood's been off, but my labs are okay. I eat. Right. What am I missing?" And when I gently ask about his masturbation habits, there's often a pause, sometimes a shrug, sometimes a nervous laugh. Most of the time, he hasn't even considered that it might be part of the issue. Let me be absolutely clear. Masturbation is not the problem, but how often you do it, and whether your body is recovering makes all the difference. Especially after 60, when you're younger, your body rebounds fast, your testosterone levels spike back within hours, your nervous system resets quickly, but as you age, those processes slow down after orgasm. Your body experiences a dip in testosterone and a rise in a hormone called prolactin, which brings on that feeling of sleepiness or even mild depression afterward. When you're in your 20s or 30s, that dip is short-lived, but in your 60s, it can take days for your body to restore hormonal balance, and if you're masturbating several times a week or even daily without proper recovery, you're keeping your body in a constant cycle of depletion. It's not just about energy either. Frequent ejaculation without rest can lead to lowered libido, weaker erections, difficulty sleeping, and even increased irritability or brain fog. Your system never gets a chance to return to baseline. I've had men tell me, "I thought it was just getting older." But when they reduced their frequency and allowed their bodies more time between sessions, everything improved. Mood focus, even motivation. Sometimes the frequency comes not from desire, but from habit or emotional coping, loneliness, boredom, anxiety. These emotions don't just disappear in retirement, and for many men, masturbation becomes a form of escape. But the escape becomes a trap when it leaves you more exhausted than before if you find yourself doing it. Not because you feel truly aroused, but just to pass the time or avoid discomfort. That's a signal worth listening to. I remember one man, we'll call him Walter, who came to me at 72. He was sharp, kind, and deeply frustrated, "Doc, I feel like I've lost my spark." He said, "I'm not depressed, but I'm not excited about anything anymore. I sleep 8 hours and still feel tired." We talked through his habits, and it turned out he was masturbating daily, sometimes even twice a day, mostly out of boredom. I asked him to take a toe break, not forever, just long enough to give his nervous system a reset. It wasn't easy for him at first, but by the end of the second week, his energy was higher, his sleep was deeper, and most importantly, his desire came back stronger and more focused. "I finally feel like a man again." He told me, "That's what I want for every man who watches this. Not shame, not restriction, just awareness and the power to make choices that serve your long-term vitality." So how do you know what's too much? There's no magic number, but a general rule I recommend for men over 60 is no more than 2 to 3 times per week. And only when your body genuinely feels ready. If you feel drained afterward, or if arousal feels forced, that's your body asking for space, respect. Recovery isn't weakness, it's wisdom. It's how you preserve your strength instead of burning through it. You may find that the less often you stimulate, the more powerful the experience becomes. Your erections might feel firmer, your orgasms might last longer, your emotional connection to your body might deepen, and in many cases, your desire for meaningful intimacy, not just release, comes back. Online. Now, if you're thinking, "All right, I'll try cutting back," that's a great step. But here's the catch: if you're still making this next mistake, even a healthy frequency might not protect you. Because while most men focus on the act itself, almost no one talks about this one small part of their body that plays a massive role in sexual health, and it's being silently damaged every day without them realizing it. Let me show you what I mean. Mistake 3. Ignoring prostate health while masturbating. When you've been practicing medicine for over 3 decades, you begin to notice patterns, and one of the patterns I see most often in men over 60 is how little they think about their prostate until it becomes a problem. Most men don't know much about this small gland. It sits deep inside the pelvis, about the size of a walnut, and yet it has an enormous impact on your sexual health, urinary function, and overall quality of life. And sadly, many of the prostate issues I see could have been prevented, or at least delayed, if only the man had known what his body was trying to say. What breaks my heart is that some of the habits men believe are safe, even healthy, are quietly irritating or overworking this sensitive organ. I'm talking about the way we handle ourselves during masturbation. Most men were never taught how to touch themselves with awareness. The truth is, by the time you're in your 60s or 70s, your prostate has already gone through decades of wear and tear, and unlike your muscles, it doesn't bounce back easily. It becomes more vulnerable to inflammation, swelling, and congestion. A lot of older men develop habits over time that they don't even realize are harming them. I've had patients tell me they use intense squeezing, prolonged edging, or masturbation without full arousal. Some go through the motions quickly, others push their bodies too hard. Chasing release, The problem with these patterns is that they put excess pressure on the prostate and pelvic region, and the damage builds slowly, quietly. You might not feel it right away, but then come the subtle signs: a dull ache in the groin, more frequent urination at night, or trouble starting and stopping your stream. Sometimes it shows up as reduced ejaculate volume or a change in the sensation of orgasm. Often these are dismissed as just part of aging. But I can tell you in many cases they're not. They're signals your body's quiet, way of asking for a different kind of care. One man I worked with. Frank was 66 when he came to see me about urinary frequency. He was waking up 3-4 times a night. His scans didn't show anything alarming. But when we dug deeper into his habits, he revealed he'd been masturbating roughly the same way for over 40 years, fast, tight, and almost mechanical. I asked him to make one simple change: slow down, take his time, use lubricant, focus on sensation, not speed. Within a month, his symptoms started to ease. 2 months later, he was sleeping through the night again. Not every case is that straightforward, but I've seen this story play out again and again. The key is respecting the prostate as an aging organ, one that requires gentleness, attention, and sometimes a bit of restraint. If you're masturbating without arousal, meaning you're doing it out of boredom or habit, rather than genuine desire, that can create tension in the pelvic floor and place strain on the gland. If you're not using lubrication, friction can irritate the delicate tissues and surrounding structures. If you're forcing yourself to reach orgasm when the body isn't ready, that internal pressure can disrupt natural fluid flow and leave you feeling sore or depleted. Taking care of your prostate doesn't mean giving up pleasure. In fact, it often leads to deeper, more satisfying experiences. Use warm, non-irritating lubricants. Allow time for natural arousal. Avoid squeezing too tightly or clenching your pelvic muscles, and always empty your bladder afterward to help flush the urethra and reduce irritation. Drink water. Move your body. These small actions go a long way. I often tell my patients, think of your prostate like the engine of an old, reliable car. It will keep running and running well if you maintain it with care, but ignore it or push it too hard, and eventually it breaks down in ways that are hard to reverse. And here's the other truth. You may not notice the damage until it's too late. Prostate inflammation can be chronic and low-grade, just enough to drain your energy, disrupt your sleep, or dampen your sex drive, but not enough to make you rush to a doctor by the time it shows up clearly in your blood work or your scans. It may already have caused months or years of slow decline, so don't wait for symptoms. Start treating your prostate like the vital organ it is. It's not about being afraid, it's about being informed. You have the power to change course at any age. Now, if all of this is starting to sound like more than just a physical issue, you're absolutely right. Because there's another mistake I see so many older men make, and it goes even deeper. It's not about the technique or the frequency or the body part. It's about what's going on emotionally in the quiet moments when no one's around, and that next mistake might just be the one holding you back the most. Let's talk about it. If you're still watching and these insights are resonating with you, go ahead and comment the number 1 below. It lets me know you're still with me now. Let's keep moving forward with point number 4. Mistake 4. Masturbating without movement. Sedentary stimulation. I can't tell you how many times a man has walked into my office and said, "Doc, I don't get it. I'm doing everything right. I'm not overdoing it. I'm cutting back on porn. I'm being gentle, but I still feel numb down there, like there's just less life." It's always followed by a look of quiet frustration, sometimes even embarrassment. They feel disconnected from their own bodies and they can't figure out why. And more often than not, it leads me to ask one simple question. When you masturbate, are you moving your body at all, or are you just lying back letting the whole thing happen while still as a stone? Almost every time the answer is the same. They're sitting or lying completely still, sometimes in the same position for years. It may sound like a small detail, but I assure you, it's not when you don't involve your body in the process. Especially after 60, you're cutting off one of the most important ingredients to sexual health. Blood flow as we age, circulation naturally becomes less efficient. That's just part of the deal. The heart works a little harder, the vessels aren't quite as elastic, and the blood doesn't move quite as fast. That's why movement matters so much more in later decades of life. When you masturbate without engaging your muscles, without shifting your hips, without doing anything to encourage pelvic circulation, you're starving the very area you're trying to bring to life over time. That stillness can dull sensation, weaken erectile response, and even contribute to pelvic floor dysfunction. Something most men don't even realize they have until it's already interfering with urination, sex, or core stability. I remember one patient in particular. His name was Tom. He was 71, retired, widowed, and told me he still had a strong desire, which I was glad to hear, but he admitted he almost always stimulated himself while sitting in his recliner, sometimes even falling asleep after no movement, no engagement, just routine. And over the last year, he said it had started feeling more like a chore than something pleasurable. It's like flipping a light switch that barely works. He said that image stuck with me. So I asked him to try something new. Nothing radical. I didn't tell him to start working out or doing yoga. I just asked him to stand during arousal, maybe. Shift his weight. Take a few slow steps. Stretch his legs. I also introduced him to basic pelvic floor exercises. Not complicated routines, just a few gentle contractions to wake up the area. After a few weeks, he came back smiling. It's like I flipped the switch, and the lights actually came on this time. He told me, "You see, your sexual system is part of a whole network. It's not just nerves and hormones, it's blood, oxygen, muscles, and posture. When you stay completely sedentary during self-pleasure, especially in the same chair, couch, or bed, you train your body into a state of passivity. It learns to respond less. It forgets how to build arousal through physical engagement, and it stops communicating the way it once did. You lose the natural connection between your arousal and your energy. Your breath, your heart rate, even something as simple as standing up before you begin or gently engaging your hips, glutes, and thighs during stimulation can reignite that connection. Try taking a short walk beforehand. Try breathing deeper. Stretch your lower back. These small signals to the body say, wake up, be present, circulate. What's powerful about this is that it doesn't just affect the moment. It affects your long-term vitality. Movement improves nitric oxide levels in your blood, which is essential for erections. It reduces inflammation. It supports testosterone production. All these benefits from simply refusing to stay still in one fixed position. And no, you don't need to turn your self-pleasure into a workout. This isn't about effort. It's about awareness. It's about relearning that your entire body is part of your arousal system, not just one isolated part. As we get older, the more we include the body, the more the body responds now. If you've been nodding along, realizing that maybe your chair has become your default partner, it might be time to rethink the routine, because what you're doing now may feel easy, but it's also quietly numbing your responsiveness. You have more power than you think to reawaken those systems. But here's the thing, even if you're moving, even if you're treating your prostate gently and spacing things out with care, there's one more trap I see older men fall into. And this one's not about the body at all, it's about the heart, because sometimes what's really holding you back isn't physical at all. It's emotional, and unless you face it, no technique or tip will truly restore what's been lost. Let me explain. Mistake 5. Using it to escape emotional pain. Instead of facing it, I've always believed that the body doesn't lie. You can ignore the signs, you can push through discomfort, you can distract yourself, but sooner or later what you haven't faced emotionally will show up physically. And nowhere is that more true than in the lives of older men who turn to masturbation, not for connection or release, but for comfort, for escape, for silence when the loneliness gets too loud. I've lost count of how many conversations I've had with men in their 60s, 70s, and beyond, who finally admit with a quiet voice, "Doc, sometimes I'm not even aroused. I just do it because I don't know. It helps me feel something or nothing, at least for a little while." And that moment, that honesty always hits me hard, because I know that kind of silence. I've seen it in the eyes of widowers, in the voices of veterans, in the shoulders of men who've watched their lives shrink down after retirement, after loss, after decades of holding everything together. And yet no one talks about this. No one tells men that it's okay to feel grief or sadness or even numbness, that it's okay to miss the version of themselves who used to feel strong, needed, desired. So what happens? That emotional hunger gets buried, and in its place, habits form, quiet ones, solitary. Ones like late-night masturbation. Not because of pleasure, but because it briefly drowns out the ache of missing something or someone. Now let me be clear, there's nothing wrong with seeking comfort. We all do it, but when masturbation becomes a way to avoid pain rather than process it, it slowly chips away at a man's sense of self. He starts to feel disconnected from his body, not more in tune with it. The act that once symbolized life and vitality becomes mechanical, a momentary escape that leaves him feeling even more alone after it's over. I remember one patient, Harold, 74, retired. Engineer, lived alone since his wife passed 7 years earlier, still sharp, still kind. But as he put it, the days blend together. Now he told me he masturbated almost daily, but not because he was particularly aroused. It was just a way to get through the evening. "It's something to do before I fall asleep," he said. But when I asked him how he felt afterward, he paused, empty. He admitted, and more tired than before, that word empty. It stuck with me, because that's exactly what I've seen so often. Masturbation used in this way doesn't nourish it, doesn't restore it, just numbs, and over time it dulls, not just sensation, but spirit. But here's the good news, and I want every man reading this to hear it. You are not broken. You're not too old to feel connected, to feel alive, to feel deeply. What you're craving isn't just release, it's meaning, it's intimacy. And that begins not with someone else, but with the way you treat yourself, with the honesty you're willing to bring to your own inner world. If you notice that you're using masturbation to avoid feeling something, try to pause before you begin. Ask yourself, what's really going on? Are you lonely, bored, anxious? Is there something you haven't said out loud, even to yourself? Sometimes that small act of self-awareness is enough to shift the entire experience. It turns the moment from escape into reconnection, and when you bring awareness, compassion, and intention into your most private moments, they stop feeling empty. They start to feel sacred. I often suggest that men journal before or after, just a few sentences, nothing formal, something like "Today I felt," or "Right now I'm needing these." Small moments of reflection help ground you in yourself again, and from there, other doors start to open. Conversations, friendships, sometimes even new love. Because here's the truth. Healing isn't about stopping masturbation. It's about reclaiming it as something intentional, not unconscious, something you choose, not something you use to run away. And the men who begin to understand this, they don't just regain their sexual vitality. They regain a piece of themselves they thought was gone. They start to move through life with more ease, more joy, more connection. And it's not because they've figured out a trick. It's because they've chosen to face what's real and to stop hiding from it in silence now. If this has stirred something in you, if you've seen even a glimpse of your own story in these words, then you're already halfway there. You're listening. You're open. And that means you're ready to do something many men never give themselves permission to do. Take their health, their pleasure, and their emotional well-being seriously. Because in just a moment, I'm going to bring all of this together, what these 5 mistakes have in common, how they're connected, and most importantly, the simple shifts that can help you reclaim not just sexual wellness, but a deeper, richer relationship with yourself. Stay with me. You've come this far. Don't miss what comes next. Conclusion. Ignoring what your body is trying to tell you, if there's one common thread running through all 5 of the mistakes,